Hey everyone, this is Dr. Ryan at Primal Chiropractic, and in today's video blog we're going to be discussing osteoarthritis and its root cause. So first we're going to break down some anatomy. We'll be looking at the knee joint here first. At the ends of the two bones that make up the joint, there's a specialized type of cartilage called articular cartilage, which is able to withstand compressive loading. Joint cartilage in a normal joint is approximately 70% water, making it exceptionally hydrated and essentially incompressible. So when we take a look at the joint capsule next, it surrounds the joint. Just inside the joint capsule is a structure called the synovium. Joint fluid is called synovial fluid, which is supposed to be produced throughout life by special cells in the synovium. Synovial fluid is especially slippery, so movement can occur that is smooth and resistance-free within the allowable range of motion in a given joint. So a normal joint is essentially incompressible and exceptionally slippery unless it is forced to deal with abnormally intense loads, or if the structure of the remaining 30% of the joint cartilage is rendered pro-inflammatory and osteoarthritic due to poor dietary choices. So next we're going to be looking at a healthy joint on the left and an arthritic joint on the right. This is usually the presentation that you'll see on an x-ray. And the main enzyme that starts to create this arthritic process is called a matrix metalloproteinase, or we just call them an MMP. And these are the enzymes that degrade connective tissue. Now it's important to understand what MMPs are because they degrade joint cartilage to cause arthritic changes that are seen on all of these x-rays. When we eat a pro-inflammatory diet, we produce what's called pro-inflammatory cytokines. Some of these are called interleukin-1, interleukin-6, and tumor necrosis factor. And these disrupt the cartilage homeostasis and help direct that progressive MMP buildup. Not only do the pro-inflammatory cytokines promote the degradation of collagen and proteoglycans, these same cytokines inhibit chondrocytes in joints from synthesizing adequate amounts of collagen to keep the joint healthy. So it's important to know if you are at high risk for developing osteoarthritis. We really don't have pain until it gets pretty severe. So you're going to have an underlying osteoarthritis until that pain eventually comes on. We know that 60% of people that have type 2 diabetes have osteoarthritis. Cardiovascular disease and anybody that has high LDL cholesterol is at high risk. So there are no lab markers for MMP, unfortunately. However, here are a couple important lab markers you can get tested to see if you are at risk for developing osteoarthritis. First is our hemoglobin A1C. We want this below 5.7. C-reactive protein, or CRP. We want it under 1 milligram per liter. And finally, we just want normal LDL cholesterol levels, otherwise they can start getting oxidized by high sugar in the body. So the best way to treating osteoarthritis is taking the preventative approach. The first thing that will help the most is consuming an anti-inflammatory diet. An anti-inflammatory diet avoids three main things: refined grains, oils, and sugar. By doing this, we reduce all those inflammatory markers in the body, including that MMP enzyme, which is known to destroy cartilage in the joints. Think of supplements and cortisone shots as if you don't change your diet, they most likely will have no effect, and it's just going to be a long on and off cycle of possibly feeling slightly better and then going right back to stage one. Exercise is also known to reduce inflammation in the body and help joint health. If you want a more detailed approach or need assistance with this, we offer this in our Primal Reset group. Typically, we offer this quarterly throughout the year, and we help guide you to understanding what a preventative lifestyle approach is all about so you can live a long, pain-free, and disease-free life.